Our last panelists for this first panel are Maud Pontel and Melpa Kamateros. The title of their presentations is A Quebec Perspective to Address the Needs of Immigrant Women Victims of Domestic Abuse. Melpa Kamateros, Executive Director, was born in Cyprus and came to Canada when 4 years old. Her background is in political science with a graduate diploma in community politics and the law from Concordia University. A journalist and writer, she has designed many public awareness programs with communities and the ethnic media on conjugal and family violence. She's also one of the founding members of the Shield of Athena, Family Services and the Shelter La Maison de Athena. Maud Pontel, coordinator, immigrated to Canada in 2001 to pursue graduate studies in social work at the University of Quebec in Montreal. Her academic background and professional experience led her to specialize in the issue of violence against women and intervention in an intercultural context. Since 2008, she worked as a coordinator of the Community Outreach Department for the Shield of Athena Family Services. Welcome, Melpa and Maud.
Alors, bonjour tout le monde. Hi, everybody. So we're very, very happy to be amidst this illustrious panel to be able to speak to you about a tailored approach with specialized services, what we've done in Quebec, and how we address the needs of ethnocultural and immigrant women victims of conjugal violence within our network of services at the Shield of Athena. First of all, we're going to give you, this is the outline of the presentation, so we will be giving you a general overview of the Quebec response to conjugal violence, issues with the existing services, and community strategy as developed from an outreach program on family violence to a network of services. Some statistics on Quebec. In 2012, 19,731 persons were victims of crimes against the person in a conjugal context. And these are sources, this comes from the Department of Public Security of Quebec. But of course, these are only the reported cases. It's much more worrisome to figure out about the cases that are not reported, as many of our presenters stated previously. In Quebec, we have a very, very long-standing government commitment against conjugal violence. In 1986, the Politique d'intervention en matière de violence conjugale, which was a policy on conjugal violence, was presented, and it involved a concerted commitment by various sectors of the government so as to facilitate the criminalization of conjugal violence and to facilitate and humanize the services for victims, particularly those regarding judicial intervention with the victims. It engaged 9 ministries in a formal way. There were many, many directives that were issued for each of the every ministries and recommendations as well. And every 5 years, this politique has been reworked, and it's part of the provincial policy on violence against women, on conjugal violence. The most recent 5-year plan of Quebec that came out in 2012 has the emphasis on prevention, screening, intervention, detection, and combating conjugal violence. And it has 100 different policy directives, different engagements, and another 35 on Aboriginal communities, for Aboriginal women and communities that are deemed to be doubly vulnerable in Quebec. The police have a very, very sort of long-standing commitment to conjugal violence, and actually it is one of the top 4 priorities for the police services in Montreal. The police in Montreal, we have to say, are very, very well trained, and actually Maud is conceiving a new training program on honor-based violence for the police of Montreal presently. It is very, very victim-oriented. And it receives approximately 15,500 calls a year through the 911 service, 30% of which are crimes against the person and 15% of which are homicides. A year after the Politique en matière d'intervention en violence conjugale came out, that confirmed the government concern for conjugal violence, we came out with the SOS Violence Conjugale line, 1987, which is the provincial line for victims of conjugal violence and family violence. It provides active listening, referrals, and it deals with 25,000 calls annually. And what happens in the cases of immigrant and ethnocultural women are, it finds out what shelters in Quebec provide linguistic services, and if they understand that a woman on the other end is Greek or Hispanic or Portuguese, they try and refer her to the appropriate shelters. There are over 100 shelters in Quebec. There are approximately 13,000 women and children that they handle annually, 1,000 beds. And the occupancy rate is close to 80%. In our shelter, La Maison d'Athena, that has been adapted to meet specific needs of immigrant and ethnocultural women, the occupancy rate is 98.4%. So we have 1.6% to play with. And of course, there are many tables and committees regarding conjugal violence, the most important of which are the Comité Interministériel that regroups all of the ministries in Quebec that are associated with the theme of conjugal violence, Ministry of Justice, Ministry of Health and Social Services, Public Security, etc. Some special initiatives that have been developed are a protocol between the police and the CLSCs, which are the parapublic community clinics, where during the first 24 hours of police intervention, the woman, the victim, is referred to the CLSC where a consultant can speak with her. And as of 2010, there was also a protocol regarding children exposed to violence that took actually 9 years to develop. And this is a systematic intersectorial screening, referral, and intervention service. Now, of course, we're all aware of the issues that immigrant women encounter when they try to access the existing services. And from a woman's or victim's perspective, the issues are two. One is accessibility of the services, and the other is once you access them, are they adapted to your needs? So in the cases of immigrant and ethnocultural women, we see that they are not only encircled by the cycle of violence, but they are also circled by the cycle of isolation with the various factors as listed there, and also the cycle of powerlessness. And I will pass it on to Maude now, my colleague, so she can explain certain issues that present.
Thank you very much. I want to say when I arrived in Canada in 2001, I was very impressed by the system who was put in place for victim of conjugal violence. But when I was at university, I realized that the services were not that well adapted when it comes to conjugal violence for immigrant women and women from ethnocultural communities, because there is some very specific needs and specific barriers. Like a lot of the women, they do not speak the language, they do not know their legal rights, they do not know where to go. And with the work that we have, the work that we are doing at the Shield, we do a lot of demystification of the services, because a lot of the women, some of them are not aware that the police can intervene. Like some of them do not know that as soon as they call 911, the police can come and they can arrest their husband. And a lot of them, they are not aware of it. Also, a lot of the women, they have no support, no family support, no community support. Some women came here by themselves or through the sponsorship program, but they have no relative here. So when they are victim of conjugal violence, they can go back to their mother's place or their family, and sometimes they also have to deal with very, very strong pressure from the community and from their family. We see a lot of women who are, we see a lot of women in our center, in our shelter also, who have to suffer from their family and their community who force them to stay in an abusive relationship as well. So they are trapped. In a certain way, they are trapped because there is the cycle of isolation, due to the conjugal violence situation. there's also like the isolation created by the integration process, like when you don't speak the language, when you don't know the system, and also like they are suffering from an isolation from discriminatory practices that we can see like in different, area in the society. So the Shield of Athena tried to give an answer to all those questions and try to answer those needs, the needs of the women from community, ethnocultural community, victim of conjugal violence. So I will let Melpa continue because she is one of the founder of the organization.
The organization began in 1991, and initially we didn't have the intent to work with victims. We wanted to inform the community at large on the issue of family and conjugal violence, because the issue was such a private one. It was so much rooted in the family. It was such a taboo issue that people didn't want to talk about it openly. So we wanted to promote more open talk. And the organization was a grassroots organization developed by through a loose group of women that were all interested in the same thing. It was also an inclusive policy that included men and women in the public awareness program. And I'd like to congratulate the men that came here tonight. Thank you very much for coming. Yes. And we have to have more of them come, because the issues of conjugal violence, family violence, violence against women is not exclusively for women only. I mean, there are other people at play. So there we go. That's how the organization began. And of course, after we did the public awareness programs, we began to receive a lot of victims that had fallen through the cracks, that had nowhere to go, that couldn't speak the language, and that voila, had the issue of conjugal violence defined to them in one fell swoop, and they realized all these years they were not crazy, they were victims of a specific issue. And I'd like to pass the microphone to my colleagues who will continue.
So the idea was really to develop an approach to suit the needs of victims and community. And because we are working a lot with immigrant women and women from ethnocultural community, it was very important to promote access to social justice through equal access to information and services for victims. And as we said earlier, there is a big barrier when it comes to understanding the information. So we use a lot of the mother tongue, and we take in consideration cultural and religious aspect. So we also work a lot with communities. That means that we are working with ethnic organizations, community leaders, spiritual leaders, ethnic media as well. We create a network with a professional from a different sector, and we design a tailored and non-threatening approach to talk openly about conjugal and family violence with community. That means that we also think that it's very important to address this issue of conjugal violence with the community, because when the woman wants to leave an abusive relationship, she has to have the support of her community as well. So it's very important to make visible in the community. And what we can say is that we want to work with the philosophy of going from isolation to integration. So I'm going to try to go fast. In terms of services, we provide services to victims, but also to community. And we are very lucky in our team because we're able to speak around 15 languages. So that helps a lot when it comes to, helping women from different communities who are not able to speak French or English. We have a network of services. We have 2 offices, one in Montreal and one in Laval. Laval, it's in the suburb of Montreal, and it's the second region after Montreal to receive the most important rates of new immigrant in Quebec. We have also a shelter since 2004. It's the 10 years anniversary this year, and we have a multilingual outreach department. And we won. I'm pretty proud to say that we won an award by the Health and Social Services Ministry of Quebec, because we do a lot of work with communities. We go there and we give information on their rights, because we know that not knowing rights, it's like that put you in a very stressful situation. And we give a lot of information also on conjugal and family violence.
When speaking about victims of conjugal violence with a precarious immigration status, we have noticed that there is a higher vulnerability in the caseload that we deal with within the network that Mo just explained. Some statistics from last year. At the shelter, 18% of the clients had been sponsored. Of these 18%, 38% had not been fully processed. There was another 11% that were refugees, requesting refugee status, or without status. So, in all, 29%, or roughly a third of the women in the shelter last year, were women in a vulnerable and precarious position regarding their immigration. Of this percentage, over half had problems communicating in English or in French. And this situation was even more serious or more evident at the two external services centers, where I have to distinguish there is some overlap with the shelter, but not much. The clienteles at the external services are totally separate at times, because not all women in Quebec that are victims of conjugal violence decide to go directly to a shelter. More choose to go to centers for external services. So at the centers, 45% of the long-term dossiers or files presented severe linguistic barriers. For us, language is a very, very important factor. The presence of language barriers, in addition to a precarious immigration status, increase the level of victims' vulnerability and may result in either her staying in or returning to an abusive relationship.
So very fast. Our response to this issue. For sure, like when it comes to working like with immigrant women who have like a very precarious status, immigration status, what we see is that the situation is really more complex. It's more complicated. And those women, they have like very, very specific needs in terms of information, in terms of services. And we know like through our statistic that those cases take like more time. And it's very important to be sensitive to that, because like those women, they have nowhere to go. They have nobody to rely on. And we are here to provide a strong and continuous support system for those women. So in terms of response, we work a lot in terms of accessibility and adaptation, accessibility to services and information. We develop a lot of multilingual tool, pamphlet, booklet, website, and as I said earlier, like the outreach activity and advocacy. We do a lot of it. We also created and adapt our services to ensure that the woman will not go back in their abusive relationship. And with, like all the changes in the law, what we say is that we're not working in the same way, because we try to make sure that the woman will not stay in an abusive relationship. And with the law, we see that they are forcing to stay in an abusive relationship. So in terms of adaptation, we have our shelter, who was very specifically designed to reply to the need of immigrant women. We also created cultural intermediary services because we realized that for those women, it was very important to have our own trained interpreter, like our bank of interpreter, who will be part of the entire process, like from the bus to through the bank to the court, because what we see is that those women, they need a very strong support system to do like all their procedure. And So with the cultural intermediary service, we are able to provide, we provided like more than 500 services to 51 women just the past year. So we can say that it's a very good system to reply to this very specific issue. And also another adaptation, it's partnership. And like we know that when we are like together, we can be stronger to help those women to overcome their situation. Voilà.
Merci beaucoup.